The state is going to drop its mask mandate for schools on March 12th. LA is lifting its indoor mask mandate today, so we are starting to see some progression. Infectious disease expert Dr. Peter Chin Hong is live in San Francisco joining us to talk about changing to an endemic way of life. As always, it's great to see you, sir.
Same here, Melanie. Thanks for having me on.
Of course. So the CDC is saying there have been about 140 million coronavirus infections here in the U.S. That's about 42% of the population. So do you think we can now transition to an endemic way of living based on the large number of people who have natural immunity?
That's a great question, Melanie. And of course, more than 100 million folks having had COVID or seen COVID is much more than the 71 million that are officially counted. So it means that a lot of people got exposed and they didn't even know it. And a lot of people, of course, were doing testing at home, so it wasn't counted officially. So I think it's really interesting. And, you know, I would still call it the next phase or the new phase rather than endemic yet, because endemic requires two things. It requires that it become predictable. And right now it may be predictable, meaning that if it comes back every winter, and we can prepare for it, we'll know for sure. But right now we're just holding our breaths and crossing our fingers. The other thing that endemic requires is that we don't have as many deaths. So we still have almost 2,000 deaths a day. That will probably come down. And as long as the deaths remain low and it becomes predictable, you're right, we will then call it endemic.
Right, because some doctors are still worried about a pandemic surge again, seeing the rise, maybe a surge again in another variant other than Omicron or Delta. Now, when it comes to vaccines, are these just going to become routine, like how we do flu vaccines, or, you know, even for kids getting the measles and mumps shots every year?
Yes, I think it will be routine because, again, what you're seeing is that the older population is becoming more and more immune with successive waves of and surges. But the new kids being born haven't really seen anything before. So eventually what will happen is that the youngest kids will be the most vulnerable in society, just like what happened in the 1918 flu pandemic. So I think we'll be prepared to have it as a routine vaccination. And that's really how it's being set up now with the vaccine trials, because they said, you know, instead of doing 2 doses of the higher dose, let's kind of integrate it with what is done in kids normally. And if people know in the audience, kids routinely get 3 to 5 doses of many vaccines at childhood.
Right, okay. And I think one thing can be said for certain, COVID-19 has really just changed everything in terms of medical practices, the way we go about our daily lives. It really has changed everything, I think maybe for a long, long time for the foreseeable future. And I would love to talk to you all morning, but we have to wrap up this interview. Peter Chin Hong, thank you so much for joining us once again and offering your insight.
Thanks so much, Melanie.
Okay, take care, sir. 8:20 is your time right now. Let's get on over to Adam with a look at our forecast.
Melanie, thank you very much. Dr. TCH always has the answers.